Hope you're doing well. Today we're going to talk about antimicrobials, and we're going to talk about what is an antimicrobial, of course, and we're going to talk about, most importantly, how to differentiate them, ideally clinically, so that you know when you might use a more immediate, acute formula, as in some of the more acute conditions that we see, like colds and flus, and then maybe when you might use a deeper antimicrobial to work with a more chronic or more difficult to move infection. And that gets us right away into what is an antimicrobial. An antimicrobial isn't simply something that kills. It's something that might, sometimes we say, stun, kill, or clear. It might help inhibit replication of a microbe. It might help directly kill it, of course, that's a big part of what we do. Or it might help with the clearance of, the removal of, and we'll talk about some alternatives for some of that. What we also want to know is which situations to mix them, how to mix them, what goes well together, and maybe what goes less well together. And probably most importantly, when we really talk about botanical prescribing, is how to overlap some of the secondary actions, like when we talk about antimicrobials for decongestant or expectorant, so that we get the optimal benefits out of the formula that we've selected. What is an antimicrobial? Sure, anything that really helps the body clear an infection, be that acute or chronic. Sometimes, although we won't really talk about it today, sometimes the immune stimulants or the immune modulators can also class as antimicrobials because they help, although they help from a little bit different direction, supporting the body clearing an infection. Specifically today what we're talking about are things that help directly and immediately with that infection. What do we mean by infection? What do we mean by pathogens? Here we'll talk. Usually, most of the infections we deal with are going to be bacterial or viral, but certainly we are still going to see some antimicrobials that are specific to parasites. One of the things we'll look at when we go through the chart will be to say which antimicrobial has which specificity. Some are very broad in action, and we still use the term antimicrobial, but others really are more specifically antiparasitic, antifungal, antiviral, and antibacterial. So let's take a look now at a bunch of them. We're certainly not going to review all the details of every one, but we'll try to hit the highlights of some of the main antimicrobials that we use. And we'll start with some of our bigger ones, some of our broader acting. Possibly one of my favorites, although it's certainly not the least expensive herb out there, is Hydrastis canadensis, golden seal. Excellent, strong antimicrobial. It just about always helps, and sometimes it's all that's needed. It's also an excellent decongestant, and this is one of the probably most useful secondary actions. Hydrastis canadensis sometimes often being called king of the mucous membranes because it is so toning and drying to the mucous membranes. In fact, one of the particular cases in which we use Hydrastis are in difficult sinus infections or congestion in the head. We can give that orally, certainly. We can also give it via a neti pot or a neti syringe, where it's particularly for sinus congestion, where it's brought into the sinuses and then helps clear that. In a pinch, particularly if congestion or a runny nose is really pronounced, a pinch of Hydrastis can be put into the old anatomical snuff box and quickly dries out the sinuses. So that's our golden seal, an excellent, strong antimicrobial. Another one that's a very broad-acting antimicrobial is clove, Syzygium aromaticum. This one, broad spectrum of action. I like it preferentially for GI infections, but certainly you can use it for upper respiratory tract infections as well. We should mention with clove, even more so than with Hydrastis, with any of our strong antimicrobials, these are strong antimicrobials, and they will have some of the same side effects as conventional antibiotics, the biggest one being if you take clove or oil of oregano or even sage, over a period of time they will start to disrupt healthy gut flora. So much like with conventional antibiotics, using concurrent or afterward probiotics, probably an excellent idea to help balance and heal that gut flora after an infection. So that's our clove. One of the tips for clove that I really like it for is you can chew clove, and it's especially useful in situations like traveling on an airplane or whenever you're in a large group of people, because that's when, of course, you're most likely to get an infection. And that's where I use it personally the most, is whenever I travel, I bring a little bag of cloves with me, and I'll take some on the plane, but I'll most importantly take some or slowly chew them almost like candy, but they're not candy, and help prevent an infection. If I feel even a little hint of a sore throat, clove is a good go-to there. Next, we've probably got 4 we can put together: sage, rosemary, oregano, and thyme. The reason we can put these together is they all contain as their main constituents essential oils. Essential oils will always be, at least a little, sometimes very potently, antimicrobial. They'll also always be a little carminative, but if we talk about oregano, for example, usually it's too rough, too irritating to the GI to really be classed as a carminative, though of course it will have some of those properties. One of the other useful, interesting things to mention is that sage, rosemary, thyme, oregano, these are also culinary herbs. And part of the reason they are culinary herbs is that pre-refrigeration, these herbs would be rubbed onto meat to prevent infection of the meat. So we think of them as culinary herbs, but they became culinary herbs because they were aromatic, because they were antimicrobial by nature. These ones you can use, you certainly can't use them quite interchangeably, but anywhere, these ones are particularly useful acutely. These ones show up where there is respiratory tract infections, sometimes upper GI infections, but particularly where you've got some congestion. In particular, rosemary I find really nice for a cough, especially if it's a new onset, early cough. It probably has its antimicrobial primary action, but as its best secondary action, I would say it is a relaxing expectorant. You could say the same for sage. Sage is a little more drying and it's much more cooling. So sage will also help break a fever or support a fever, but usually we think of it as a cooling diaphoretic, which means if fever is very high, we can use that to bring that fever down. Easy tip that you can certainly share with your patients for antimicrobial use of these culinary herbs is simply, as soon as you feel an infection coming on, go to the kitchen. I do this all the time. Go to the kitchen, just put a bunch in them. Don't worry about even tablespoons. Just put a bunch of whatever you have into a pot, put the lid on it, boil it for 45 minutes. Or you can simmer it for 45 minutes, about the same. But give it a good long steep or boil, and what you have on the other end is a very potent antimicrobial, antibiotic. Drink a liter of that a day for a few days, and that will certainly perform as well for regular colds and flus as any antibiotic. And of course, we know with antibiotics, the less you take, the better, and there's some truth to that with our herbal ones as well. But when you get sick, these are excellent things to help you get through that as quickly as possible. We've got on the bottom of this list here, we've got Berberis vulgaris. This one is similar to Hydrastis in that it has berberine. Hydrastis has, of course, berberine in it as well, but it doesn't have hydrastine, which does seem to lend some of the magic to our Hydrastis. Berberis vulgaris, still an excellent antimicrobial. Little less acute than those aromatics that we just mentioned, but still quite an excellent one. The difference being, like Hydrastis, it's a root, so you need to decoct it if you want to use it as such. You can certainly put it in, but it's good as a tincture as well, as any roots are. However, this one doesn't taste very good, and we probably should have said that about Hydrastis as well, in that Berberis and Hydrastis both are very bitter and not especially pleasant. Nor is this next one we see on the list, in my opinion, which is garlic. Garlic, very good antimicrobial. This one probably more specifically antibacterial. It has some, I believe, antifungal properties as well. But if you take a lot of garlic, you will smell like garlic, and there's just no getting around that. It's fine if you're okay with that, but be forewarned. Most of us already knew that. Particularly useful for GI infections, because that's where a lot of it shows up. But for the same reason, this is what we have on our notes here, for the same reason that it makes people smell, it's also very useful for skin infections. Some of its elimination is through the skin and through the lungs. So when we've got infections hanging out on the skin or the lungs, a lot of internal garlic is optimal. Best is fresh. That's a little hard on the stomach and a little hard on the GI, so roasted is fine, but if we want the highest activity, fresh is pretty good. I find capsules are okay, but I don't think they have quite the same efficacy as really actually consuming the garlic. Now we start to get into a few that are more antifungal, antiparasitic, and just about everything that's antifungal will also be antiparasitic. Those two actions really quite nicely overlap. We've got our wormwood, our Artemisia absinthium, we've got our black walnut, we've got our podarco, and to some degree cat's claw. The research is still kind of catching up with that one, but it does seem to show up for more difficult infections, some viral infections, and for fungal parasitic infections. Probably of this group, black walnut's one of my favorites. I find this one quite nice. This one, although all of these will be harder on the GI than some of the other ones that we mentioned. But these ones are quite useful for more difficult suspected parasitic infections. The other thing you can do with these ones is you can use them topically as well for fungal infections. As I'm sure anyone who's a practitioner knows, topical fungal infections can be very resilient and very difficult to treat. These can be used as a wash, these can be used as a tincture as a wash, and they can be taken internally simultaneously for optimal effects. Now, of course, the other thing we haven't talked about for topical infections are essential oils. Those herbs that we just mentioned a moment ago, those aromatics, can be applied topically for infections, as long as there's not an open lesion to help with infections, particularly fungal. So looking at our next set here, we've got a few more. Now we've got Arctostaphylos. This one makes the list. It's not a broad antimicrobial, it's really more of a specific antimicrobial in that we use it predominantly in the genitourinary system. So for UTIs, this one is particularly useful. And this one works best when the pH of the urine is basic. So if that is known, which is pretty easy to find out with a simple UA test, this one converts best when pH is closer to neutral. Now we've got Lomatium, Ligusticum, and Baptisia. These are herbs that really tend to be for deeper, more difficult infections. Some would say more specifically viral. However, a lot of the bacterial infections seem to respond quite well to these as well. These ones should be used more cautiously, in my opinion, in that they're not entirely toxicity free. Now, they're not high toxic. You can rest fairly comfortable in knowing, but for example, we know with Lomatium, one of the side effects is a rash, and there's some photosensitivity there, so that's a possibility. Use these more preferentially when you've got a deeper, chronic, lingering infection, particularly if you don't even really know where that infection is. So we see in a lot of patients that identify with Lyme disease or some of the more broad presentations of fatigue, weakness, pallor, dizziness. Sometimes these, and I like to put Hydrastis in this group as well, can be excellent herbs to use in these conditions. Of these, probably our Osha, which is our Ligusticum, more specific, a little bit more specific for the respiratory tract. I should even say Lomatium and Ligusticum, and Baptisia a little bit. When you taste a good tincture of these herbs, you can tell they do something. They really have a special feel, a special taste. They even look different in tincture. They're sort of a lighter but a creamy, almost milky color. You can see that what they are and their constituents really are a little bit unique. So these tend to be, and in fact, these tend to be viewed sometimes as tonics. And a lot of the eclectics actually class these plus our golden seal, our Hydrastis, as tonics as much as they class them as antimicrobials. In a time when there was just simply a lot more infection hanging around, these herbs were used to clear that infection. Echinacea makes the list here. We think of it mostly as an immune stimulant. That's where a lot of the research is focused, but it's still a pretty good antiviral. There's a lot to be said about Echinacea, and the most exciting and sometimes frustrating thing of Echinacea is that we don't actually fully understand how it works. The constituents we originally thought were most active may not be, and even the extraction method suggests that what we thought as the 1 to 2 being optimal, actually in the most recent meta-analysis was the least effective, as at least a preventative and an antiviral, as compared to the traditional 1 to 5 in about a 30 to 40% extraction. So there's lots we still don't know about Echinacea. However, it does seem to be pretty good at treating infections. I like it for viral infections, and I've even used it sometimes topically along with St. John's wort, glycyrrhiza, and lemon balm as a topical antiviral for herpes lesions. So there's a fair, and there's lots to say about echinacea. Another one that shows up very commonly is our myrrh, our Commiphora. Commiphora is good. It has some challenges though. Because it's a resin, it's very potent. Because it's a resin, it has to be extracted in high percentage alcohol, which means to take it internally, you're getting a lot of alcohol, and basically as soon as it goes in the mouth, it starts to come out of solution. Doesn't mean it can't be done. It certainly can, but it's potent, it's strong, it's fairly unpleasant. Usually it's done in very low dose as well. So personally, it's actually not one I use too often as an antimicrobial, though it certainly will show up and does deserve to. It is very well established as an actual antimicrobial. Looking at what I think is the last of our list here, here's our St. John's, or definitely not thought of primarily as an antimicrobial, but used, I think, very effectively as an antiviral, both internally and especially in this case, topically. So it makes this list as an antiviral, mostly topical for herpes lesions. Now we get into vaccinium. So this is our cranberry. This is a great example of, it's an antimicrobial by definition, but mostly it's an anti-adherent. It's fairly specific to E. coli, and it's fairly specific to treating E. coli infections of the bladder by preventing their ability to adhere to the surface. So it prevents them from forming biofilms, it prevents them from hanging around. However, used on its own, not especially effective. Part of an overall treatment, quite effective. Best dose usually is a high dose and usually of the concentrated unsweetened juice. I haven't worked with capsules enough to have a strong opinion there, but it does seem to be that for the most part it's the juice, the good stuff, that provides the best benefit, especially in a UTI where we want to flush that through. Another herb that probably should be, not even probably, should be classed with some of our deeper infection herbs is Dipsacus, which is teasel, which is particularly useful in Lyme and other difficult infections. The research is only okay on this one, and it's pretty new. So we're not exactly sure, but it's an herb that became part of the research, started to be looked at because deers who carry the spirochete that is responsible for Lyme and some of its other infections eat Dipsacus. They will seek it out and eat it when they are infected. And so that was noted and people started looking into it. There's okay research. Is it part of an overall plan? Probably. And should it be included at this point? It's up to you. I usually include it, but the research is only all right on this one so far. Probably it will come through. Next on our list here, we've got our Thuja occidentalis. This one conveniently grows in great abundance around here. This is our cedar tree. This one is also very strong. Like Artemisia, it contains thuone, which is both cytotoxic to infections, but also it is stunning to the infections as well. So it will slow down reproduction. It's an intoxicant to a lot of microbes. So it can be a very useful one. It's as simple as gather it, boil it, make a strong decoction of just the leaves themselves, although it does tincture quite nicely. This is another broad, strong, potent antimicrobial, not without toxicity though. At a certain dose, you would start to see some of the side effects of intoxication, probably from the thuone, much like Artemisia absinthium, which was used to induce some hallucinations. You probably could, although I've never seen it, if you had enough of the cedar. Next, we've got our Glycyrrhiza glabra. That's our licorice. We talked about this one specifically as an antiviral, which is good. It does have some antibacterial properties as well. It has a great secondary action of being certainly an adaptogen, which is always useful, but also a really nice demulcent. So in an upper respiratory tract infection, Glycyrrhiza makes a nice choice of an herb to at least include, particularly if it's a viral infection, as that will help soothe the respiratory tract. Where I've found it particularly useful is in post-viral cough. We've seen every few years there's a viral infection that presents with a lingering cough, and I've found one of the nicest things to do for that is to actually have someone chew, almost like they're chewing tobacco. Not everyone can relate to that, but like they're chewing tobacco, pack it in, slowly chew it over several hours, and as you swallow the juice, you're essentially mouth decocting it, it acts as a demulcent and a nice antiviral. Lastly, our Usnea barbata. This is our old man's beard. This is a lichen. It grows on trees once trees have started to decay. This one, again, mostly used for urinary tract infections, but can be used, and I've seen it in a few places, used for upper respiratory tract infections as well. So to wrap up our discussion, our differentiation of antimicrobials, there are lots of them. And certainly this wasn't even close to an exhaustive list, but it should round out the broad categories of action, some of the main herbs that we use clinically for antimicrobial, antiviral, bacterial, fungal, maybe even antiparasitic. Knowing how to choose one can help improve your clinical outcomes. In acute infections, favor the aromatics, favor the ones that are more essential oil based. The deeper the infection, the more you go into some of the herbs that contain alkaloids, the more you go into some of the bitter herbs. You could certainly mix them together, and certainly I often do, but helping to make that differentiation and knowing, for example, the aromatics are useful at breaking up congestion. They act as expectorants. That can be a nice way to help decide when to use which one. Best of all, I think, or most importantly of all, or most clinical significance of all, is when using an antimicrobial formula acutely, just do antimicrobial. Often our formulas will be clove, oregano, sage, thyme, rosemary, maybe some licorice, all put together and given in pretty high dose. When it comes to antimicrobials, this is often where I dose the highest. I'm not afraid to go as high as 3, maybe even 4 tablespoons a day for that 3 to 5 day period. Now you could say if you're using tincture, that's a lot, and you're absolutely right. If you're using tincture, that's a lot. All of the herbs that we reviewed today can certainly be made into decoctions, and many of them can be made into infusions, and often that will be the preferable method of delivery for our antimicrobials. So I hope that's provided some guidance, some insight into how to combine and compare some of our antimicrobials. Good luck, have fun.